Now see this question. There is a proptosis in a child. This is ophtha plus patho. Proptosis hai along with a Desmin positive tumor. Now there are two things. First of all, if I am talking about proptosis in a child, and they have already admitted that it's a tumor. Now which tumor is most common in the children? So if I talk about the tumors, okay, remember the flow chart that it can be the primary tumors, it can be the secondary tumors, and it is the secondary tumors which are actually more common in the eye. Now, good evening. Now, if they talk about primary tumors, then it can be the intraorbital tumors also, or it can be intraocular, right? Now, because they are saying Desmin positive, that means it's not intraocular, but let's discuss both. So, this can further be divided into the adults or childhood. This also in adults or in the childhood. So, if I talk about intraorbital in adults, it is the cavernous. It is the cavernous hemangioma. And intraorbital in children, it is the rhabdomyosarcoma, right? So it's a myo because Desmin positive means it is related to the muscle. So most probably it's a rhabdomyosarcoma. Intraocular in adults is a malignant melanoma, and intraocular in children is the retinoblastoma. Now retinoblastoma is coming from the blast cells of the retina. So this cannot be the answer. So we are thinking in terms of rhabdomyosarcoma, and it's a Desmin positive also. So therefore there is no confusion that the answer will be the rhabdomyosarcoma. Now one more thing. Whenever you are having a rapidly progressive supranasal mass in a child, okay, suppose you are having a rapidly progressive supranasal mass in a child, then you have to consider it as a rhabdomyosarcoma unless proved otherwise. A very, very important dictum. Unless proved otherwise, you have to consider it as a case of rhabdomyosarcoma only. So this will again help you in solving the question so many times. Why we had considered this as a rhabdomyosarcoma only, why we have not thought about retinoblastoma, because this has to be considered always as a rhabdomyosarcoma unless proved otherwise. Okay.